So how do we know that acupuncture can help with fertility? And there's really 5 ways. So we're talking about blood flow, specifically to organs that are responsible for eggs or for sperm or for maybe gestating a pregnancy. We're talking about endorphins, neurotransmitters. We're talking about blood sugar metabolism and insulin resistance. So those are 5 really clear mechanisms that we have been able to measure and see differences when we do acupuncture.
Welcome to the Egg Whisperer Show. I am so excited to talk about acupuncture and IVF outcomes with Dr. Lee Hullender Rubin about all things acupuncture and her recent publication on the effect of acupuncture on IVF-related anxiety. Welcome, Dr. Lee.
Thank you so much for having me.
Dr. Lee Hullender Rubin is an award-winning doctor of acupuncture and the founder of Rosefinch Health. She blends compassionate care with over 2 decades of clinical experience specializing in fertility, IVF support, pelvic and vulvovaginal pain, and cancer-related support. Dr. Lee is also an accomplished teacher and researcher of acupuncture and integrative East Asian medicine, having authored more than 30 publications during her career. She recently founded Rosefinch Academy, a continuing education hub for acupuncturists to learn how acupuncture and integrative medicine can support fertility. I'm so delighted to have her join me today to talk about all things acupuncture and her recent publication in Reproductive Biomedicine Online on the effect of acupuncture on IVF-related anxiety. So for people unfamiliar with acupuncture, can you give us an overview of what it is and how it works?
Acupuncture is one treatment within the whole system of Chinese medicine. And, other treatments that can fall into this is gua sha, which is having like a social media moment right now, cupping, which you may have seen on athletes, Chinese herbal therapies. Acupuncture itself is a treatment where we insert sterile, solid needles into the tissues underneath the skin, and we're trying to promote self-healing. So we place these needles in specific locations based on Chinese medicine theory, as well as Western medicine goals, like we want to improve maybe the frequency of ovulation or helping blood flow to the ovaries, that sort of thing. So I want to just say that Chinese medicine uses an explanatory model that's based on the concepts of yin and yang and qi and blood. And while those are ways for us to kind of understand how well the body is in balance or healthy, or how sick or unbalanced it might be, we also are considering, like where is someone in their menstrual cycle? What kinds of hormone levels do they have? What kinds of cycle are they doing maybe with you as a fertility doctor? So I do want to show you really quickly what it looks like to get acupuncture for those that don't know. So hopefully you can see this. This is a little acupuncture needle and it's solid, as I said, and I'm just going to insert it into my skin. And right there, hopefully you can see that. So when we do acupuncture, I'm just going to take it out really quick. You might notice here, for those that are listening, they won't see this, but this is a really flexible needle. It's very small. It's 0.2 millimeters. But we put multiple needles into the body at one time, and we let someone relax for about 30 minutes after we do so. And when we do this, we're trying to promote a few things to happen. And so we see multiple changes that are measurable by like blood work, neuroimaging, ultrasound. So you can see there's a complex response from this deceptively simple looking intervention.
And I could barely see the needle. It's probably less painful than plucking an eyebrow.
Yes.
You said something about social media moment and you used a term that I wasn't familiar with. What is that?
Gua sha is a type of treatment where you use a flat tool to sort of scrape the skin, but you use it gently. And it's one of these things that are really being used to like loosen muscles, help support blood flow. It's a really lovely therapy.
Now that you mention it, I've definitely seen people using it, and actually on social media. So How does acupuncture actually help with fertility and fertility treatment?
There's some really great research that's been coming out over the last 20 years, and it's really been looking at mechanisms that help us understand how acupuncture might be working. And one of the ways that we know for sure acupuncture is inducing a change in the body is through measuring endorphins. So we see an increase of endorphins happen every time we place needles into the body. And that's great for pain and incidentally also for stress. We also see changes in blood flow. We see changes in skin temperature. We can see changes in the organization of the brain. So that's called neuroplasticity in the research. And we also see this remodeling of loose connective tissue. And for those that don't know what that is, it's this really collagen rich tissue that surrounds everything in the body, from blood vessels to muscles to glands. And we don't fully understand what loose connective tissue does, but one of the hypotheses is that it might be complementing the nervous system, and it might also be complementing the endocrine system and their functions. So I'll stop with all of those details just simply because we could literally spend hours going through the data on all of these and show pictures and all kinds of cool stuff. But really, we're here to talk about fertility. So, how do we know that acupuncture can help with fertility? And there's really 5 ways. So, we're talking about blood flow, specifically to organs that are responsible for eggs or for sperm or for maybe gestating a pregnancy. We're talking about, again, endorphins, neurotransmitters. We're talking about blood sugar metabolism and insulin resistance. So, those are 5 really clear mechanisms that we have been able to measure and see differences when we do acupuncture.
Well, I'd also love to hear your personal story. Like, what drew you to the world of acupuncture and specifically treating fertility patients?
This might surprise you. When I was 17 years old, I joined the Air Force, and I quickly realized this will not be my life's path. Like, that was just not going to be the thing. And I started to go to school and focus on some area of medicine. I wasn't sure what, but when I got out, I really did get very interested in acupuncture and East Asian medicine. So I completed my graduate training in Seattle and Shanghai, China. And I really came to this specialty specifically of reproductive medicine in this class that I took on special topics of the reproductive lifespan. And we had this one section on fertility, and I was just infinitely interested in it. And, I'm an adopted person. My parents who adopted me, they had a fertility issue. I've imagined there's some sort of influence there. Maybe that's what helped me be so interested in it. But I was really lucky to be mentored by a very experienced fertility acupuncturist. And then ultimately, I just kind of took the ball and ran with it. I ran an IVF acupuncture program at a fertility clinic in Seattle. And I really started to wonder, like, hey, I think we're seeing something here. I think there could be a measurable difference, but I didn't know how to do that. And that's what brought me back to a doctoral program. I did a NIH postdoctorate research fellowship, and really basically I've just kind of continued clinical care, really looked at ways we can understand how this works. And basically I just really like data.
And I know that you really like treating the whole person as well, while focusing on the root cause or causes of what they might be dealing with. So, what does that look like for someone who is doing an IVF cycle?
Fertility acupuncturists like myself, and I talk to a lot of colleagues and I train acupuncturists, we're generally considering both Chinese medicine explanatory models of how fertility is occurring and all of the parameters on the Western side. So when we're putting together our treatment plan, we really want to be thinking about both of those things. So yes, I want to address the root cause, but I'm also learning how well someone sleeps, or how well they digest, or what kind of foods do they like? And are there reproductive toxins that they're consistently exposed to on the daily? So I'm really trying to think about all of the ways that I can help support that person who's going through a treatment with you or with another clinic to have the best outcomes while also putting together that acupuncture treatment plan as well.
One of the most commonly asked questions I get: what does that look like when I'm doing acupuncture during IVF? And so when you say you're focusing on, let's say, the eggs or ovarian stimulation, the lining or the sperm, like, what does that actually involve for someone who wants to work with you or another fertility acupuncturist?
I think it's really important to clarify with patients, what are they doing? in their treatments. So, is this a stimulation cycle where we're going to bank eggs or we're going to bank embryos? Do we need to also be thinking about treating the person who's providing the sperm and their partner? Or are we doing a frozen embryo transfer? Are we really focusing our treatment there? I really am thinking about several ways to make this work. Like, I want to see people once a week at least, but I also want to give you things you can do at home so you can be empowered and to extend the benefit of the therapy. So, when we look at the research, what we know right now is that IVF acupuncture may help improve birth outcomes. There are some trials that have been done, there's several trials, but they all have different designs. And so, it's really difficult to interpret the data because it's mixed. So, like if you look at one style of trial where acupuncture is compared with people who are relaxing, or maybe they don't get any treatment at all. When you put all those trials together, you see a 27 to 30% increase in the chance of live birth and a 43% reduction in miscarriage. And that's pretty great. And when we look at it, when acupuncture is compared to a sham needle or a placebo needle, we don't see those same outcomes. So you might be thinking, well, was there a there there? And I would actually say maybe there could be, because there's a lot of data out there around the sham and placebo needles being a little more powerful than other placebo controls, and that they might be obscuring any detectable benefit because we're not actually comparing real acupuncture to quote nothing. Do you know what I mean?
Oh, absolutely.
So then the other thing is that when, my own work, I've looked at, we've done several cohort studies, and these are non-randomized. We look at people after they've already gone through treatment and we say, hey, okay, how many treatments did you do? What happened? And what we've seen is roughly 9 to 12 sessions supporting an IVF cycle was associated with more live births, fewer biochemical pregnancies. And another study, it's smaller than mine. I had about 1,000 people in my study. A smaller study found fewer miscarriages. So I think that it's important for us to know, what are we really looking at here? And that is that it appears that there could be some benefit. We need to better understand how to measure these things. But I think also the other piece about this is that this is a very safe therapy. It's not harming anyone, especially by a trained acupuncturist. The other person that we're thinking about, the person with sperm, right? They need at least 75 to 90 days to see a difference. So hopefully we can start seeing them a little bit earlier. And I might actually send them home with another therapy in addition to acupuncture, which is called Transcutaneous Electro-Acupuncture Stimulation, or TEAS, which is basically a TENS machine on acupuncture points. And there was a small study out of China a couple of years ago where folks who did that every day for 30 days had an improvement in count and motility.
Wow. How long is each session?
30 minutes for themselves. And for the sperm, they did it every day for 30 days, took a break for 2 days, and then repeated it again. I'll share that study with you if you want to
Less
see
than
it.
tens. I definitely do. Okay. I see tens units coming to people's doors soon. Whatever we can do to make the embryos look great. So is this approach different for, let's say, someone who's doing IUI, or is it about the same?
Yeah, so it'll be a little bit different because when you're doing an IUI, you are focused on more than just, retrieving eggs or maybe an embryo transfer. So we're kind of tailoring treatment for each phase of the cycle. We're thinking about the menses part of the cycle. We're thinking about follicular development, robust ovulation, hopefully sperm meets egg, implantation at the appropriate time, and then supporting a potential pregnancy. So we're doing it all within one cycle.
And how can it help people who, let's say, have been given the diagnosis of DOR, which stands for decreased ovarian reserve, or POI, which stands for primary ovarian insufficiency?
Yeah, this is a group that I really have a lot of interest in. So when we look at our data from the 1,000 people cohort, the people who often fall under the DOR sort of umbrella term, so we know that the diagnosis is a little bit challenging sometimes. People aged around 38 to 42 really do show to be associated with more live births than the other age groups. And when they add the acupuncture to their IVF process, we see that they do a little bit better. So I don't want to imply, though, that acupuncture is like this panacea for everything, but I do think that there's a significant role that it can play specifically for patients in this particular category. And in this case, I will also use my acupuncture. I might also add an LED light therapy and the TENS machine on points specific to them that may help them. So there was another study that looked at transcutaneous electro-acupuncture stimulation in about 240 people with diminished ovarian reserve. That's how they entitled it. And that the people who did tease or this TENS machine on acupuncture points, they had a significant reduction in FSH. So people who had high follicle stimulating hormone, it came down. And then the AMH or anti-Müllerian hormone came up to more normal levels, as well as the antral follicle count that came up as well. So we also found what was interesting is they needed less drugs, less gonadotropins, and over fewer days, and they had a higher pregnancy rate. And that was all compared to a mock treatment of this tease. So it's a pretty interesting study. I would really love to see it replicated here in the United States, so that we could confirm that that's exactly what we saw. But I do think it's a good enough signal because it is a safe therapy that we could add it in to support these patients.
And is this something that you can support a patient in? So let's say someone who can't make it to your office, do you do telehealth visits where they can get the teas, get your counseling on it, and get coached along the way?
Precisely. That's exactly what we do.
That's amazing. And are the same principles in place when treating endometriosis or PCOS?
We are going to alter the way we approach care based on those kinds of diagnoses because it's different metabolic things that are happening, especially with polycystic ovarian syndrome. You're seeing more inflammation, systemic inflammation in both of them. But with endometriosis, I was very fortunate, by the way, to work with the UCSF endometriosis clinic when I was there. We're really wanting to focus our treatment to address pain if there is pain, to reduce inflammation. We're not probably going to be able to resolve lesions or actually chocolate cysts with just acupuncture itself, but we are going to be able to use the whole system, like the diet approach, the lifestyle support to reduce the oxidative stress that is helping to promote the inflammation, reduce pain, and then just help the whole process hopefully be more receptive to the treatment and be able to continue. Like that's really my goal. I don't want you to give up because it's too uncomfortable, you know? Now, with polycystic ovarian syndrome, we have a lot more research about that. There's a really powerful group out of, prolific, I should say, group out of Sweden, and they work a lot in China as well. And they have found lots of different outcomes when they've added acupuncture in both animal models and in human studies where acupuncture helped to improve ovulation rates, improve menstrual frequency. So, having a regular cycle, helping to modulate some of those features that are common in polycystic ovarian syndrome, like high androgens or insulin resistance, and maybe that the blood sugar is too high. So it's like helping your body to absorb the glucose appropriately through the skeletal muscles or your muscle tissue. I'm not sure we're going to see a big signal with respect to improving birth outcomes or getting pregnant, having a baby with just acupuncture in the short dose. But I do think that from my own experience, when we add acupuncture alongside with treatments like metformin, treatments like ovulation induction medications, that patients they appear to get pregnant quicker. We need more research on this ultimately. But again, coming back to the coping aspect of this, I do think patients are able to stay in treatment longer. And if they need to go to IVF, that they respond well and they can finish the treatment, get pregnant, stay pregnant, have a healthy baby.
And I also find that in my patients who are doing acupuncture, they're less anxious. So if they've already come to me having done acupuncture, they just feel just more informed, more educated about the process. And I think a lot of it has to do with the acupuncture they're receiving and the fertility acupuncturists they're seeing. So I'd love for you to just share with us about the science there of how and why treatments work to help with anxiety. And I think you've also published a study about the impacts on IVF.
Yeah, we just finished this paper. Well, I should say we just published it. It was published in July at Reproductive Biomedicine Online. And this was a project I did at UCSF before I moved back to Portland. So our research question was, does acupuncture help with IVF related anxiety? And we wanted to find studies that looked at acupuncture as a treatment alongside IVF, and that they also asked people, okay, well, how anxious are you? So we found 8 studies that did that. There was about 2,200 patients that were involved in the cohort, basically. And when we did the meta-analysis, we found that over 1,700 study participants did actually fill out one of those anxiety questionnaires. And then we found that acupuncture provided benefit to these patients suffering with IVF-related anxiety. And ultimately, the benefit was small, but it was clinically relevant. Now, I do want to say, because I am a researcher and I believe in being able to be as open as possible. I think that over time this research outcome is going to change. I think as more research is done, we're going to see a different result. But here's what we do know is that based on the mechanism research, we know that folks are going to have a release in endorphins, which is going to help them feel more relaxed. We know that if they do more treatment, more neurotransmitters will be released, so that potentially that could also impact baseline anxiety. The other thing I will say is that in this study, we looked at trait versus state. So state anxiety was the thing we looked at. And state anxiety is where, you have anxiety in response to a stressor, which makes perfect sense, right? Like there's lots of places in IVF where, am I going to have enough eggs? One of the first questions folks have is in the moment they come out of the anesthesia with the egg retrieval is like, how many eggs did we get? So there's many places in the process, like, am I pregnant? Am I going to stay pregnant? We really are thinking about ways to help support patients to be more even throughout and regulated throughout the whole process. To contrast with trait anxiety, that's really anxiety where it's just your baseline operating system, if you will, is to be at a slightly higher, more anxious level. And that's always also a challenge. And part of what we're doing is trying to also sort of down-regulate one's nervous system so they don't feel so dialed up, if you will.
Yeah. And then how do you think anxiety can complicate fertility treatment?
I think that this is a really important question. My former colleague at UCSF, Dr. Lori Pash, she found anxiety and depression were highly prevalent in those seeking fertility care. And you might already be familiar with this study, but half of women and 1/3 of men were clinically depressed, and 3/4 of women and 2/3 of men were clinically anxious. So this is clearly very prevalent. And this can be so much so, and this is really to answer your question, the level of distress can be so much that folks don't want to continue treatment. And this is before they're actually able to reach their goal of getting pregnant and having a child. So one of the things I'm thinking about is, how can I help someone be resilient? How can I help them continue through treatment? And so that, they can reach their goals.
Is there a way that you approach your acupuncture treatments if, let's say, you're dealing with anxiety related to being a fertility patient compared to someone who doesn't have that anxiety and is doing IVF?
Yeah, you're not going to have to change it too much, because what we know from the mechanisms is that you're getting multiple responses based on acupuncture. And now we are tailoring treatment to the individual. So I might add a couple of extra points specifically for, that we know for sure calm the spirit. Like there's this one right here that everyone loves. It's a very sedating, calming point. But in general, when you're doing acupuncture, just even to support fertility, you're going to have that added benefit to support or to reduce anxiety. This is one of the resources patients can consider to support themselves throughout their cycles. And as providers, we always want to provide folks with as many resources as feasible for them to help dial down their nervous system so they feel like they can keep going.
So I have patients who call me, they say, Amy, my period started, I want to do IVF tomorrow. I'm like, let's do it. And I give them my IVF essentials. And now I feel like I need to add fertility acupuncture for everyone. I mean, I talk to everyone about it because I know that it definitely reduces anxiety. I think it helps reduce some of the side effects of being an IVF patient, like nausea, the bloating. My patients who do acupuncture actually recover better even after their egg retrieval. And then their experience in the first trimester is actually much better. Less fatigue, less depression, less anxiety, and then less nausea as well. So I am a huge fan of acupuncture, but not everyone has so much time. So, what specifics should be considered in terms of how this is timed during an IVF cycle that you think make the outcomes better?
That's a great question. And ideally, of course, we would love to see folks 3 months before they even start a cycle. But like you just said, like that's not always reasonable or even possible. So I think what we know based on the data right now is that if you can start at down regulation, like when you're doing suppression, when you're taking the things like Lupron or you're taking your birth control pill before you start the cycle, if you can start acupuncture at a minimum there, and keep going through your retrieval or through the transfer, and your acupuncturist will be able to tell you what you need. That will likely be the most beneficial dose of acupuncture. And that's something, though, we don't have a 100% slam dunk answer for. We don't know exactly how many sessions are going to be the magic number that makes everyone have a perfect outcome. And I don't think anybody will ever know that. And that's just the way it's going to have to be. But what I will say is that if you can start at that time of downregulation or when you start your birth control pill or a Lupron or something like that, that would be ideal.
Yeah, there was a clinic when I was back in the day when I was in medical school. The acupuncturists were also the anesthesiologists.
Yes.
So they would place needles even before we went in for the egg retrieval also, which I thought was kind of cool. What do you think about that?
I think that's very cool. Some of the studies that were included in our analysis were specifically acupuncture at the time of egg retrieval. I haven't done the pre-egg retrieval. I've always done like in the recovery acupuncture for like when you're coming out and you're feeling like, I feel kind of uncomfortable or whatever. It's great for the pain, as you were saying, and nausea, which sometimes can happen with anesthesia. So, I'm excited to see all the ways that we can go, but I also want to be mindful, like not everybody is going to be able to add this in at all places.
Right. And also, there's so many barriers now in terms of people being able to come in. And I wish that I could have my acupuncturist back at the clinic. And I'm just hoping and praying that that will happen soon. I'm sure in other areas of the country it's happening, not quite yet here in the San Francisco Bay Area. So, are there any other findings about your research on acupuncture that you would like to share with us?
I'm excited to share that I contributed to an abstract that was accepted at this year's ASRM meeting, the American Society for Reproductive Medicine. And we looked at individualized acupuncture on the day of embryo transfer for frozen embryo transfers. And so this is an area of the research where we don't have a lot of evidence just yet. And so this was with my colleagues in the Chicago area. They're at Kind Body, Dr. Ruhi Jalani, and the acupuncturists are Dr. Kate Philippi and Lamia Camel. And they're just really great. They've been working together for years, and they reached out and asked me to help. And I was like, absolutely. So I'm very excited to share that with you when it's actually after the meeting and it's been published. But the other area that I think that I would love for us to see more work is in the ways that we can help patients with anxiety and with depression alongside these treatments.
Well, you'll have to come back on and share with us your research findings now about frozen embryo transfers and acupuncture. We're definitely going to have you back very soon, later in the fall. So, I imagine with what you do for work, you go out to dinner parties and people are talking, and then they have these like ideas about what you do. But what do you wish people knew about acupuncture?
I think the main thing is that I want people to know it's safe. It's a safe, drug free treatment. And while it was developed thousands of years ago in China, and Chinese medicine is under this umbrella term of East Asian medicine, and that includes Japanese acupuncture and Korean acupuncture, what I practice mostly is Chinese medicine acupuncture. And the other thing that I want us all to kind of like know is that licensed acupuncturists have at least 3 years of training, graduate level training, that they have to pass board exams in order to be licensed, and that the most safe acupuncture has been performed by folks who are licensed. So there's very little data on negative outcomes when you're working with a licensed acupuncturist. I think the other thing that is important to know is that this is a deceptively simple looking therapy. It seems like it's not, like how could that possibly be doing all the things that it is? But this information that we're learning about mechanisms really does imply or suggest we're working on multiple levels. It's not just relaxation. And I think that that is an important thing for us to be considering when we're talking about acupuncture.
Do you think that there are some people who get more benefit from it than others? So, for example, I'll just run a scenario through with you right here. The patient who comes out of acupuncture feeling so good and so relaxed versus the patient that's like maybe still a little bit tense and just kind of stays there because she's just still needle phobic a little bit and just can't get over that. What do you think about that scenario?
There's this idea in research about responders versus non-responders. And you are going to have occasionally non-responders. And I think that's important that we don't force people to do a treatment that they don't like, And so when I'm working with patients and I can see, again, you're going to have your patients who are like, oh my gosh, this is the most amazing thing. I never want to leave. I get that every day. But for the person that I really clearly see is not relaxing, that is not really feeling more calm at the end of the therapy, I will have a frank conversation like, do you find this is beneficial? And if it isn't, let's think about other ways we can support you that feel more supportive, that are helping you to relax. Because, mindfulness-based stress reduction is helpful for some folks, but not everybody. Yoga is great for some folks. It's not great for everybody. Same thing with acupuncture. It's great for a lot of folks. It's not perfect for everyone.
Thank you. I'm glad to hear you say that because I think people who are listening who feel like shamed for not going back, and they have that guilt, like it didn't work because I couldn't, power through the acupuncture. So, and sometimes it's a matter of finding another acupuncturist as well. Maybe it's just not the right fit. So if you feel like it's not the right fit, maybe get one more opinion and see what you think. So, yeah. And what about doctors? I mean, I have doctors that also listen to my interviews, and there might be some listening out there. So if doctors aren't aware of how acupuncture can help their patients, what would you like to share with them about it?
I think a lot of doctors like you are already seeing how acupuncture is helping their patients. And, surveys do suggest that up to 50% of patients are already adding acupuncture to their IVF cycles. And I also think, working alongside physicians for so many years and advanced practice providers is that it is very difficult to make a strong recommendation when the data is not a slam dunk. And I get that. But I will say, I fear we may be rejecting a safe and effective therapy because it's so difficult to study. And I would just ask you to reach out and get more information before you say definitively this does not help. There is good data to suggest there's benefit, and there's also limitations to the data. And as a researcher, I recognize that. But I think also in clinic, I see that many people benefit, and there's some people it's not right for, and that's okay. I am always happy to get into the weeds. And like if we want to talk data and numbers, which we haven't really talked about here because it doesn't really seem appropriate, but feel free to reach out. I'm happy to dive in. Let's talk about where the strengths are, where the weaknesses are. And I'm happy to provide any of the papers that I've referenced today. And finally, I would just say I'm a partner. I'm here to help the patient and you help the patient get to their goals. So I really want to be part of the extended team and willing to be a part of the team.
Yeah. I mean, I often tell my patients, have your acupuncturist email me. I'll share the calendar. We'll be on the same page. If they want to know the follicle sizes and linings, we'll share the ultrasound images with them. Let's just all be collaborative. And we're all, like you said, all on the same team to help the patient. So where can people find you if they want to get in touch?
Yeah, so I have a website. It's rosefinchhealth.com. Rosefinch Health is all one word. And I'm also on Instagram at Rosefinch Health. And everyone can reach me through either of those methods.
Fabulous. Well, I want all those articles. We'll hyperlink them in the article that's going to go with our interview today. So for people who are interested in reading more, I know my patients love the research. So thank you for doing such a fabulous job sharing all the research about acupuncture and IVF outcomes. Thank you, Lee, for coming on today's show.
Thanks so much. I really appreciate it.